One of the things that's really exciting about the new advances in treatment is we are able to kind of really tailor the treatment plan to the patient's needs. 5 years ago we weren't using medication-assisted therapy. 5 years ago we weren't using Vivitrol. There are a lot of things that can be done now to help folks. And we're also a little bit more sophisticated now about folks who have multiple substances that they're using. And our ability to kind of just carefully fine tune the detox has been enhanced by the new treatments. And that's really exciting. Vivitrol is actually an injectable form of naltrexone that's long acting and lasts for a very long time. The reason it was developed is what we were finding is we detox patients, they do well, have the best of intentions, and then relapse because of some of the chemical ways that the drugs and alcohol affect their brain. Vivitrol allows for the person who wants to stay away from drugs and alcohol to stay away from drugs and alcohol by blocking some of the receptors in our brains that alcohol and drugs interact with. Our treatment in terms of detox has changed a little bit because we have to be mindful that if a patient wants to go on Vivitrol after, it kind of changes the timing and the course of the medication. So we kind of make adjustments along the lines. That's especially true for folks who have opiate dependency. One of the things we have to be really careful about with Vivitrol is not to give it too close after the detox has been completed. So there is a washout period where we're making folks comfortable without an opiate substitute like Suboxone or Subutex. So Suboxone is an opioid replacement. It's actually an opioid itself. The difference is it's less likely to be abused because of some of its properties. One property that we could use as an example is that it's long acting instead of short acting, so it doesn't create an intense craving and a need to satisfy substance use again and again and again. We can use it once on a daily basis if that's what the protocol calls for. Medicines like Vivitrol actually help with abstinence. So once you're off the substances altogether, we've kind of tapered you down on Suboxone or Subutex, and you don't ever want to use an opiate again, a medicine like Vivitrol helps you, stay quit, as we say in the industry. We don't just want to quit; we want to stay quit, and Vivitrol helps you do that. As we were designing our treatment program, we realized that there's some treatment modalities out there that have been safe and effective and been used for years that come from other cultures. We've looked into using things like sweat lodges, a traditional Native American type of remedy. People have had success with these type of modalities in the past, and we said, well, why not bring them to the detox? Also, nutrition and exercise. But the biggest thing is integrating all of these varied approaches and tailoring it to the individual patient. That's what Paragon brings to the table.